So today we are going to discuss about pterygium. What is a pterygium? It is a triangular fibrovascular growth. So we can already see in the picture, it is triangular in shape. You can see the apex is towards the cornea, whereas the base is near the medial canthus of the eye. So it is triangular fibrovascular, that is, it is made up of fibrous component and vascular component. Growth of subconjunctival tissue. It's a kind of subconjunctival tissue. It is triangular fibrovascular subconjunctival tissue which is growing over the cornea, destroying the cornea's Bowman's layer and superficial stroma. You already know that cornea has 6 layers, out of which it destroys the Bowman's layer and the superficial stroma. This is called as pterygium. So we have seen in the picture, it is triangular, it is made up of fibrous component and vascular component, it is growing towards the cornea and it is destroying the cornea's Bowman's layer and superficial stroma. This is called as pterygium. Pterygium is of two types. It can be progressive or it can be regressive pterygium. Progressive. In case of progressive pterygium, it is progressing. It will increase more and more. So it will be thick, it will be fleshy, it will be vascular with few whitish infiltrates, small white deposition you will see that are called as Fuchs spots. Then it can also be regressive pterygium. In regressive pterygium, it will be very thin, atrophic. Atrophic means that is at the end stage. Thin, atrophic, attenuated with little vascularity. Very little blood vessels will be there and presence of Stalker's line. Stalker's line are the deposition of iron pigments. Okay. Then next are what are the causes of pterygium. The causes of pterygium are it occurs because of UV ray exposure or dust or humidity, or if an individual is having limbal stem cell deficiency, then also pterygium can occur. You can already see in the picture how it is progressing towards the cornea. See, it is triangular in shape, it has blood vessels and fibrous components. Okay, next are parts of pterygium. So a pterygium consists of a head is located on the cornea, you can see in the picture. Neck is located in the limbal area. Limbus, you know na, limbus, it is the margin between the cornea and the sclera, so you can see neck there. Then we have the cap is located in front of the head, whitish infiltrates in front of the head. Then body is between the limbus and the canthus, that is on the sclera. You can see the body of the pterygium. So you have seen in the picture, first is the cap, whitish infiltrates, then head is located on the cornea, neck is located in the limbal area, and body is present on the sclera between limbus and canthus. Then comes the clinical features of pterygium. The clinical features of pterygium are it is triangular in shape, triangular growth with apex towards cornea. Then you have the Stalker's line. This is the deposition of iron pigments in the, means nature, how it is progressing. But this is types of pterygium. This is based on extent, means how much it is covering. Like type 1 is extending to less than 2 or equal to 2 mm on the cornea. Type 2 extends to 2 to 4 mm on the cornea, and type 3 more than 4 mm of cornea and also involves the visual axis. Then comes the treatment of pterygium. So first is you can surgically excise it, but it has high rate of recurrence, it can recur. Then to prevent recurrence, you can give topical mitomycin C, and you can also go for autografting. In autografting, you have to take graft from the same eye. You will take graft from the same eye, from the conjunctiva limbal autografting you can go for. And you can use sutures or fibrin glue or autologous serum to fix it. Thank you.